Hi, good morning. You're watching Colorado and Company, and oh, if we all held a magic wand and just could tap into our own personal fountain of youth, we would, right? But it's not something you'll find in a wand or even a secret potion. The magic starts with a physician who has focused his entire practice on rejuvenation on two specific areas of the body, the face and the neck. The Center for Aesthetic Facial Surgery was founded by Dr. Michael Menenkoff, the recipient of America's Top Physician Award for Facial Plastic Surgery for the years 2003 through 2009. And he has been featured in United Airlines' Sky Concierge magazine as one of their best of the best, and was recently named one of the top doctors in the global directory of Who's Who for 2009. Well, guess what? I have Dr. Michael Menenkoff right here. He joins me this morning. How are you?
I'm good, Denise. Thank you.
Well, you know, we've talked about this before, but I think it's important for our viewers to know you focus on the face and neck. Why is that so important for your clients?
Well, you know, again, once you realize that 90% of the cosmetic surgeries that are done in the United States today are breast augmentation or body liposuction, you realize that good plastic surgeons, general plastic surgeons, are spending 90% of their time doing those two things, which means they're spending less than 10% of their time on the face and neck. I'm a facial plastic surgery. That's what I do. And I'm there 100% of the time.
Perfect. We know you definitely know what you're doing then, that's for sure. And 17 years here in Colorado, that's important.
Mm-hmm. It really is. You know, facial plastic surgery in Colorado is different than it is in many other places. You compare it to Beverly Hills in Southern California, to Fifth Avenue in New York, Golden Mile in Chicago, Las Vegas, where people are going to plastic surgeons almost as a brand, where they're going to a very well-known, famous plastic surgeon, oftentimes somebody that they've seen on one of the reality shows, and they're looking for something that will brand them. So they're going to a plastic surgeon so they'll get a result so that when people will see them, they'll say, oh, you went to that particular plastic surgeon. Well, in Colorado, that's just not the way it is. My patients, they don't want people to know that they had plastic surgery. It's not supposed to be a stylized look. It really is a healthy, natural, normal look. And, you know, what we really strive for and what we work for in Colorado is that when you have plastic surgery, that nobody really knows that you had it done because it just looks like a refreshed version of you.
Wow, what a great idea. I mean, I've never understood the people who go in and they have normal lips and then they plump them up. So it's obvious. Like, what'd you do to yourself?
It really is. And it's really interesting how that they kind of get on that treadmill and the thing kind of escalates. And all of a sudden, in their eyes, what looks normal really doesn't look normal to the rest of us. It's nice for the surgeons in Beverly Hills because everybody wants everybody to know who they went to. You know, for me, it's a little more difficult because my patients don't tell anybody that they had plastic surgery.
And it's like a calling card to a lot of them. They're here. It's very natural. And we can prove that with your before and after pictures. So let's take a look really quick, and maybe you can walk me through what you did.
You bet. This gal came in. A nice gal was concerned about just looking a little bit older, some heaviness to the bottom part of her face, a little bit of sagging in her neck, some wrinkles, and we did two things. We did a quick lift, which is my version of a mini lift, 2-hour procedure. It looks really pretty good in about a week. We did a little bit of laser peel around her mouth and her eyes, and you can see that it made a nice difference. Still looks like her. Still looks natural, normal, healthy. People that saw her didn't realize that she had surgery, just knew that she looked better.
Yeah, she wasn't dragging, kind of looking tired. Exactly. Now, what about here?
Same thing here. That you know, she didn't want to look 20. She wanted to look good for her age. She had, again, the jowls that you can see and the sagging in the neck. I just felt that she looked old, and so we, again, she had a quick lift as well, and you can see it took care of the jowls, took care of the heaviness in the neck. It just looks like a refreshed, more youthful version of her. People that would see her knew she looked good, but wasn't sure why, and never would have guessed that she'd had plastic surgery.
No, she looks hydrated. She's been drinking plenty of water. She has plenty of rest. Right. You know, you do something that's different from other offices here in Colorado. You do imaging, computer imaging.
Right. Yeah, we've been doing computer imaging actually for quite a while. It's amazing how much better the technology has gotten. And in reality, what it is, people come into the office, we take their picture, we put it on the computer, and then we can make changes to their picture on the computer and give them an idea of what things will look like afterwards. You know, back in the old days, it was difficult. Someone would come in wanting to have a rhinoplasty, for instance. They'd bring in pictures of famous people from People magazine saying, I like this nose and I like this nose. And the problem would be that the nose nose might look great on that famous person's face, but it wouldn't look good on the patient's face.
Going back to the lips, everybody wants Angelina Jolie lips, but it doesn't work on everyone.
It doesn't work on everybody. That's exactly right. So this way we can actually show them what it'll look like on them, and works really nicely that way.
I did that one time with a Faith Hill haircut. I took her picture in, and let me tell you, it didn't turn out like Faith Hill.
There you go.
Why doesn't more offices in Colorado, why don't they use this technology?
You know, it's interesting. I see a lot of people that have been in for consultations with other physicians, and they've said at the other offices they've asked about imaging, and they've been told, well, we don't do imaging here because it's not very realistic, or we can't, you know, we can't promise you it's going to turn out exactly like that. And I think the real issue is that there's two ways you can use computer imaging. You really can use it as a sales and marketing tool, and if that's the case, then it's not going to work very well.
Right.
You know, someone comes in, they say, I don't like my neck, and yes, I can make their neck look beautiful on the computer, but it may not be anywhere close to what I can really do in real life. And that doesn't help me, and that doesn't help them. If you know, I show them this great neck and they sign up and we do the surgery the next day, and then afterwards they say, wait a minute, it didn't turn out quite as good as you showed. What really computer imaging should be is a communication tool. That you're able to show the patient, here's what it's going to look like. And we see a lot of really different things with that. Sometimes, you know, someone will come in, we'll show them what things are going to look like, and they'll say, well, can't you make it any better? And we'll say, well, no, that's really as good as we can get it, in which case they say, boy, I'm really glad I didn't, you know, they say, well, then in that case, I don't want to do it, in which case I'm really glad that we know about that beforehand as opposed to after. That's
what I admire about you. You're very honest, and you tell your patients what they can actually expect. Tell me about this patient. We just looked at the before, and now we have the after.
Oh, well, there we go. So, again, she came in. She didn't like the heaviness in her neck. She felt her nose was a little big and a little bit of heaviness to her eyebrows. And so in her case, we talked about a quick lift or a facelift, rhinoplasty, and a brow lift. And we were able to image her on the computer and give her an idea about what this would look like afterwards. And you can see on the after images that it doesn't look perfect. There's still a little bit of heaviness to the neck that's still there. The nose isn't a really delicate little nose, but it really gives them a pretty realistic idea of what it is that we're able to do, what we can accomplish, and then they can decide what they want to do.
Took a lot of weight off the neck, though.
It really did.
Really looked natural. And here?
Same idea with her. She, again, some heaviness to her neck, nose a little bit big, a little bit heaviness to her eyelids, and again, same things, a quick lift, a rhinoplasty, a brow lift. We're able to show her, give her a pretty good estimation as to what we would be able to achieve when we were done. And in her particular case, she was then able to look at that and say, wow, you know, the nose I don't think makes a big enough difference to me to do, but the eyes and the neck really did. And so, again, a great example, we were talking about a facelift, a rhinoplasty, and a brow lift, ultimately decided on a facelift and a brow lift, did not talk about the rhinoplasty because she just felt that didn't make a big enough difference. And doing it this way, then she's very happy when she's done because we're able to accomplish the things that she really wanted to accomplish. It's really changed the dynamic. It used to be that a patient would come in and I dictate to them, okay, here's what I think you need for what's going on. And now they're really in charge because they can look at these and say, yes, this makes more sense to me, maybe not this, and yes, this. And we can really design the surgery so that it works well for them.
I like that, but I like you still suggest things, and then you can go to the computer, look at it, and say yes or no. Yeah. What kind of special do you have for the viewers today?
Well, for this month, we're offering a special on Botox and Restylane, Dysport and Juvederm. So Botox and Dysport are injectables that help with wrinkles. Restylane and Juvederm help with also with wrinkles, but do it in smoothing them in a different way. We're giving a discount on both of those.
Very good. Well, thank you very much.
Thank you.
It's amazing, the advances in facial plastic surgery. I mean, it really eliminates the lengthy downtime and gives you that natural look. Only better. You got to love that. Call the Center for Aesthetic Facial Surgery to schedule your complimentary consultation and free computer imaging. The number, 303-792-3838. And please be sure to mention Colorado and Company when you call for their injection special. You're going to receive Botox for $10 a unit or Dysport for $5 per unit. And get $100 off a syringe of Restylane or Juvederm if you mention Colorado and Company. Now, this offer will last until Thanksgiving. Get you looking good for the holidays. The number again, 303-792-3838. Plus, you can get 10% off any cosmetic surgery booked and completed in 2009. Learn so much more about Dr. Michael Menenkoff online at thefaceexperts.com. Thefaceexperts.com, and the Center for Aesthetic Facial Surgery paid for this segment.